All right, so here we have a patient with a history of shoulder issues and neck issues. I'm testing his shoulder and his hand to see how well the nervous system is communicating. When I do the test right here, it's a little bit weak in the hand. That's what I'm mentioning. I'm also going to go over here and test his shoulder. As I push on it, I don't push hard, but I can feel it give a little bit. So at that point, I need to go back here and address where I think the problem's coming from. I'm pushing around the lower cervical, around the shoulder blade, trying to see if I get a change in the test. And I got an improvement in that muscle test. So now I'm working on the muscle around the shoulder blade. I retested again. It's still kind of weak. So now I'm going to go in with this adjuster and go on top of the shoulder blade and push the shoulder blade out as I raise the arm. Because when you raise the arm, the shoulder blade should traction down to make room for the bones in your arm to rotate up. So I'm doing this over and over again to restore some motion in the shoulder blade in hopes that when I did that test, I'll get a better test. And right there, it feels stronger already, and he commented on it. You can't see it because he's wearing a mask, but he commented on it and it was feeling better. So I'm gonna do a little bit more to get more improvement in the shoulder and get a little bit more flexibility in there. I'm gonna come back, recheck a few things. And looks like here I am now going into the muscle under the shoulder blade also to work with that on the front side so I can decrease some of the myofascial restrictions in there. It's pretty sore. He's commented on that as well, how it's pretty tender in that area. And that typically means it is a tender area on a lot of people, but him in particular because of his chronic shoulder problems that he's having. So I'm going to work on this for a little bit. And after I do this, I'll probably going to retest it and check and see if I've got better motion in there and better nerve conduction to the rest of the arm. All right, so now I'm retesting. I've gotten much better testing from both of those areas. When I did a serratus anterior, that's what his arm turned, it got a little bit weaker, so I went up to the collarbone area. And when I pushed up on it, it felt better. So then I went and did an adjustment on the shoulder to shift it back on the humerus. And that is much better. Go retest on the outside. That's holding pretty well. Now I'm having pushed backwards. And that is working with some of the muscles in the back, the rhomboids. When he pushes backwards, he doesn't have very good motion. So I'm having him turn his head different directions to see if it's coming from his neck. I'm working on some of the muscles in there. There's a muscle, that subclavius, he pops up because that's sore too. That's affecting the neck, which is again affecting the shoulder blade. Now he's commenting that the power is low on my phone, so I'm going to walk up here and click the button because it's got enough power, it just pops up. You know, the whole iPhone 20% left thing. Anyway, so I get back here and start working this muscle. Again, I'm finding some really sore areas, trying to work them out to allow the shoulder to move properly, and I should get a better test on this one. So I'll go back and retest it. That's better. I'm going to work it a little bit more to make sure I got everything. And now I'm getting up underneath the pec muscle. That was one of the chest muscles. I'm digging up underneath that, because if the muscles in the front right there, the pec muscles get tight, they tend to pull the shoulder forward, and that causes problems over time. We're going to retest it, much better. So now we're going to, because I had to work on that area, I'm going to work on the ribs. This is a standing adjustment. You can't see very well, but he leans back and I just do a lift. And I got a good release in the ribs and up in the mid-back, because the ribs come attached to the mid-back area. So now we're moving on to work on his neck, because the nervous system from the neck, again, is going to control that. So I'm getting into the lower cervical with my thumb and get a very nice release there. Opens that up. We're going to get both sides to make sure that, and I'm working not only on getting motion in the spine to take pressure off the nerves, but I'm also working on the curve in his neck. And in that one, I did a pull because he has a lot of compression issues that we've done decompression for traction. So now I'm using his left arm as a tool to test things, and I am actually touching acupuncture points. And And there's a point right there in the middle. That would be a stomach acupuncture meridian. That was a little bit weaker. I checked adrenals. I'm checking another area for hormones. And the only one I noticed was right in the middle between the, what do you call it? The belly button and the sternum. That's an alarm point for the stomach. So then I went and checked the mid-back from testing. And a lot of times if you adjust the mid-back like I'm doing now, when the nervous system restores communication, then I get better communication to the stomach, and oftentimes that stomach one will get better. So now I'm retesting that one. That's doing much better. That I corrected it. I go back to that stomach meridian point, and it looks like it's still a little bit off. So now I'm going over here. I'm tapping some stomach tonification acupuncture points that are on the feet. I'm going to retest it. Feels a lot stronger. So now we're going to go over there, and I'm going to tap that alarm point for a little bit. I'm moving the camera so you can see a little better. So I'm going to tap these points, and then I look over, and I think I realize that that red bucket is in the way, and that's bothering me. So I'm going to move it too. There you go. So now we tap the feet here. It's on the top of the foot. Tap that for a little bit, and I'm going to actually adjust the foot as well, because if that talus bone gets locked up, it sometimes can affect the acupuncture system, which then would affect the organ system that it's associated with. We're going to go back up here to the stomach, retest it, doing much better. All right, so now I'm happy with that. Now we're going to go check the psoas muscle. It's given right there. You see it's not holding like it was. I'm going to dig into the psoas muscle, and it doesn't improve it. So I'm like, okay, now what am I going to do? So now I'm going to have him put his hand on his lower back, because the nerves from the lower back supply that muscle with input, and it gets a lot stronger. So now I'm going to have him roll over, face the camera, so I can contact that L5-S1 area and the SI joint to take some pressure off the nervous system, restore motion, and then I should get a better test on that psoas. The psoas is super important because that muscle can get tight, and it connects to your lower back and pulls on it and pulls on your hip as well. So now we're going to go here and check that. And an interesting thing too is if you look at gait, when you're walking, your left leg swings when your right arm swings. So we've got a right arm shoulder area problem. So you definitely want to make sure that left leg and that left hip are working properly in order to make sure that the right shoulder is going to heal like it's supposed to. Right there, I think I was having him push straight up to see if he could hold it. Now I'm going to do a little leg pull to open up the hip and the lumbar spine, the lower back. Him, I'm not going to do the right side because I think he had a hip replacement. And so we're just going to check that. Both legs, he was able to keep it straight and push up, which is testing hip flexors, a little bit lower abs, and that was fine. So now I'm going to have him turn over on this side to balance out his pelvis, since I already adjusted the left side. And you can see a little bit how we contact the lower back. Use my body weight to drop on it, and it moves just fine, which is great. So next, I'm having him lay face down, and I'm adjusting my elbow right there. So we're going to get into muscle testing the hamstrings, again, to check some different areas to see if I corrected everything I was supposed to restore motion. And that right leg was given a little bit, left leg looks like it does too. So whenever I have both the lower legs and the hamstrings like that, there can be a fixation pattern we call, where the upper thoracic or upper back right there gets stuck and compressed. So now I'm going to decompress right there and go to both sides, contacting that area, open that up, and now I'm going to go back and retest and make sure that it did its job. Yep, that's a lot better. And so is that one. So now both the hamstrings are working, and it came not from a lower back thing, but from the upper back. So now I'm checking the glutes. That seems to be doing just fine. And so I'm having him stand up and sit up for me. And gonna recheck a few more things, have him push up with both arms. That seems to be working well. and have him move his head up and, well, no, I guess it was a little bit weaker. So I had him, I already worked on the thoracics and the shoulders, so I had him tilt his head back to improve the curve like we mentioned earlier on that adjustment. And I'm using my adjuster and I'm pushing it against the back of his neck and having him look up when I hit it to induce a little bit more curve in the neck, which will take pressure off the discs and off the nerves and will improve that double shoulder test that I just did, because that was a little bit off. And that should be the last thing, because the legs are working, lower back was working, the hands are working. Now we're going to check the arms. Now push again. He's able to hold it nice and tight. I'm going to go do kind of set his shoulder on the left side and the right side in a different direction. And recheck again. And I'm satisfied with that. Now I'm checking the hand again. That seemed to be a little bit off, so we're going to adjust the wrist. Just like that. Recheck those fingers. Now that's stronger. Now he's happy, and he's talking about how he's been getting better feeling in his hand because we've had some issues there.